Hi there, I'm Dr. Cheryl Lowes and I'm a GP in Liverpool. We are currently seeing lots of children with winter infections and we want to offer some simple advice for parents about how to protect your child from being ill in the first place and when you might need to seek medical attention if they do. The vast majority of common winter infections, including coughs, colds and sore throats, are caused by viruses, and children usually get better within a few days without any medical treatment. If a child has a sore throat and also has a runny nose, cough, and sometimes earache, that is usually caused by a virus. Antibiotics do not work on viruses, and your child will recover by themselves. You can give plenty of fluids and rest and paracetamol to help your child feel better, and they may find it easier to swallow foods that are soft. You may have heard on the news this week that some children are becoming very poorly with a bacterial infection called Group A Strep, and we want to provide some reassurance to parents. Group A Strep is a common bacteria. A few of us carry it on our skin and in our throats, and it does not always cause illness. Right now, we are seeing a higher than usual amount of strep infections. Most of these are mild. It can cause different types of infection, like a sore throat, impetigo, which is a skin infection, and scarlet fever. It is important for parents to be aware of the signs of scarlet fever. Scarlet fever is when children get a sore throat with a fever, headache, and a rough rash on the body which feels a bit like sandpaper. Their cheeks may appear flushed and their tongue may be very red and look like a strawberry. If you do see this combination of symptoms in your child with fever, sore throat and a sandpapery rash, contact your GP or NHS 111. It is usually a mild illness, but we recommend that children with scarlet fever are treated with antibiotics to prevent more serious illness. In rare cases, children can also get more severe infections called invasive Group A Strep, or IgAS. These infections are caused when the bacteria get into parts of the body where it is not normally found, and where they can cause more serious illness like the lungs or bloodstream. The really sad news that a small number of children have died from invasive Group A Strep will be worrying for parents. But it is important to know that most children who get ill from a Strep A infection will have a mild illness which can easily be treated with antibiotics. When thinking about more severe cases, parents know their children best and should trust their own judgment when they are poorly. If your child is unwell and getting worse despite paracetamol or ibuprofen, please contact your GP or call NHS 111. Contact NHS 111 or your GP if your child has a temperature that has lasted more than 5 days. If your baby has had a dry nappy for 12 hours or more, or is crying without tears, or your child shows signs of dehydration. It is normal for a child's appetite to reduce when they have a mild illness. But if your child is feeding or eating much less than normal, especially if they are drooling or appear in a lot of pain when swallowing, seek medical advice. If your baby is under 3 months and has a temperature of 38 degrees centigrade or more, or is older than 3 months and has a temperature of 39 degrees or higher, again, this would be a reason to contact NHS 111 or your GP. We appreciate not everyone has access to a thermometer, so if your baby feels hotter than usual when you touch their back or chest rather than their forehead, or feels sweaty, then they are probably running a high temperature. If your child or baby is drowsy, much more sleepy than normal, or irritable, you're unable to settle them with cuddles, toys, TV or snacks, especially if they remain drowsy or irritable despite any fever coming down, then this would be a reason to get medical advice also. You should call 999 or go to A&E if your child is having difficulty breathing. You may notice grunting noises or their tummy sucking in under their ribs or using their neck muscles to breathe, or there may be long pauses, more than 10 seconds, between breaths. If your child's skin, tongue or lips are blue, if they feel cold or clammy to touch, or if they are difficult to wake up or keep awake, again, you should call 999 or go to A&E. If your child has severe pains in their arms, legs, neck or back, or if they develop a painful red area of skin, especially if that red area is getting bigger quickly, call 999 or go to A&E. Prevention is always the best option, and there are several simple things that we can all do to reduce winter illnesses. To prevent your child picking up or spreading any winter infections, please encourage your child to wash their hands properly with soap for 20 seconds and use a tissue to cover up coughs and sneezes. If they do feel unwell, keep them off school or nursery and away from vulnerable adults and children. You should also make sure your child gets their flu vaccination, as flu can make children poorly. Additionally, flu can also make them more likely to get other infections. Finally, don't forget that if your child is unwell and you're not sure what to do, you can visit Alder Hayes Symptom Checker at any time for this advice and more at www.alderhay.nhs.uk.